Hey guys, my name is Dr. Clint Freeman and I'm with Arkansas Neuropathy and Chronic Pain here in Mountain View. This video is going to cover what neuropathy is, what causes it, what are some actual proven ways to reverse it, does insurance cover it, and if not, what does the investment typically look like? So, what is neuropathy? It's when the myelin sheath of the insulation around your nerve starts to deteriorate or die. What causes that? Well, 30% of the cases are diabetic, 30% of the cases are idiopathic, which means we don't know. The other 40% is either chemo, lower back issues like arthritis, surgery, exposure to certain chemicals like Agent Orange, certain medications. There's a whole list, but it all comes down to three important things that every nerve needs to be healthy: oxygen, blood flow, nerve stimulation. Take any of those three things away, the nerve starts to die. If you can figure out which one of those three the nerve is missing and restore that, the nerve will start to heal itself and come back to a degree. Sometimes 100%, sometimes not. It all just depends on the severity of how long it's been going on and how much actual sensory loss has happened. So how do you determine sensory loss? You come in, we do a 21-point sensory examination, we do a blood flow test, we test oxygen, we do a nerve conduction test as long as you don't have a pacemaker. We do all that information to figure out what is causing your problem. And then we go a step further. We got to determine how severe it is. Has it actually started to affect your brain? I've got some previous videos on what happens when neuropathy is left untreated for a while. It can actually start to develop issues in the brain, which can actually affect other areas of your body. Either way, if we can determine which one you're missing, blood flow, oxygen, nerve stimulation, we can start developing a plan to restore those. Now, if you've been to other neuropathy places, more than likely they told you they had to see you so many times in visit or in the clinic, and then they sent you this god-awful boot home where you had to do 30 to 40 minutes per foot 3 times a day. And then they probably gave you a bucket with a nerve stimulator, which is not a bad thing. They do work, they do help. It's just old technology is what that stuff is. The new technology, the more powerful technology, is a 1-minute protocol. 1 minute each foot, 1 minute each calf, 1 minute on your lower back, and you do that 2 to 3 times a day. So your entire treatment protocol is 15 minutes per day. So that's the new technology. Now, we still have some older, cheaper technology that we utilize sometimes, but it is still 20 to 30 minutes per foot, at least twice a day, depending on what kind of in-clinic you're doing. Now, our particular in-clinic, we utilize a technology called SoftWave. Same technology they use in the hospitals to break up kidney stones, just turned way down. Stimulates blood flow. It actually decreases inflammation and stimulates the actual healing of the tissue. It's got 6 FDA clearances and it works really, really well. In fact, some of our patients within 4 to 6 weeks are starting to have major changes in their feet, less pain, feel the floor better. It's a cool machine, it really is. But let's say you come in, we figure out how bad you are, and you're in the midsection, you're not stage 3 or 4, maybe you're just a stage 1 or 2, you're in the middle. Our typical treatment protocol is we're going to see you 10 to 12 visits while you're doing some treatments at home. Then we re-examine you, find out how much progress we've had in the first 3 months since utilizing this technology. What used to take us 12 months, we're getting in 3, which is really cool. But either way, depending on how much you want to invest in your health, and tell me what your money situation looks like. The treatments at home, we utilize infrared red light therapy. It has been around for many, many years, and it works really, really well if you have the right device. There are some cheap ones you can buy on Amazon for about 40 to 80 bucks. I had a guy come in Monday, and he couldn't afford the care plan a year ago. So he went on Amazon and got just a cheap infrared red light therapy. Now he came back a year later because his feet are starting to hurt, and we redid a test. He's actually no worse, really, as in sensory loss. So he didn't get worse. The problem is his pain is starting to increase. So you get what you pay for when it comes to infrared red light therapy. As far as nerve stimulation goes, we don't use as much depending on how severe you are, but that is an option. It also depends, once again, every case is different. There's no cookie cutter neuropathy protocol out there. Let's talk about investment. We have the lowest totem, the one for people that are on a fixed income, is we call the slow track to neuropathy reversal. It is a full year protocol. We see you a few times in clinic in a row, and then we see you once a month for the remainder of the year. And that is $150 a month. It's on auto draft, if you can afford 150, there's just no topical creams for increasing your healing rate. There's no supplementation to increase healing rate. It's just treatments in the clinic. And yes, it still works. But for those that have more of a disposable income, we have protocols that go from 1,800 up. And so it depends on just how fast you want to get there and how good a results you want to get. Either way, I hope this information helps you. As far as insurance goes, man, you've got like one option out there for insurance covered. There's a local PT that is doing some nerve stimulation DC current and billing insurance for it. I've sent a lot of people over there. It's helping with the pain, and especially those that are just on a really fixed income and they cannot afford any kind of treatment out of pocket. That's where I'm sending them. But as far as we're concerned, we can bill insurance. Just, you gotta understand, most of the time, we bill it, they will not cover it. And we've been in this game a long time. So once again, hopefully this, man, I'm in 6 minutes in. That's the fastest I've probably ever explained all that information. If you want some more information, give me a call, 870-269-8004. If you want to come in for a free neuropathy seminar, I go over this, but much more depth about exactly how it works. Those are free. We do those. So just call and say, hey, I'd like to come in for free. We still also offer what they're called as free fall assessment screenings. And so we check your balance, we check for nerve damage, because falling is a very important topic that we want to, especially balance. It's just every 19 minutes someone dies as a complication from a fall. So increasing your balance, keeping it good is important. Once again, hope this video gave you some good information. I look forward to speaking to you.